Hello and welcome to Let's Chat About That with 88.3 WAFJ. I'm John Bryant, the host of the morning show. And this evening, I'm happy to have with me my friend, Dr. Chris Apostol from Evans Medical Group. And we're going to be talking about staying healthy in a COVID-19 world. This is a subject that's been on our minds for several months now. And we have the doctor in-house this evening to get some answers to our questions. As we go along this evening, feel free to ask a question from whatever platform you may be watching on, whether it's Facebook Live or YouTube. There are chat sections there to where you can ask a question, and we'll get to it just as soon as we can. We want it to be very interactive. Chris, welcome.
Well, thank you very much.
Good to have you for Let's Chat About That. For those folks that may not be familiar with you and Evans Medical Group, tell us about your practice.
Well, I've been with Evans Medical Group for about 20 years. So actually July 1st will be my 20th year there. We're located in Evans. We are a family medicine, internal medicine, and pediatric practice. We've got 5 physicians, 2 physician extenders that are physician's assistants, and 1 physician extender that is a nurse practitioner. And so we have been in Evans at University Hospital Pavilion 3 ever since that building opened. And hopefully, if all goes well in August, we'll be moving across the street into Evans Town Center. And we have a second location in West Augusta that's currently, due to COVID stuff, is not in operation. We've consolidated everything into one location.
Yeah. And what I like about your practice is you care for the whole person. You're a very faith-oriented practice as well. You're not ashamed to say you all are believers.
Yeah. Well, that's the practice was started by Dr. Stephen Ledford, who's currently a missionary in Kenya.
Yeah.
And so the whole idea of starting the practice before, when Dr. Ledford started it, was kind of create the same kind of mentality here in the United States, where people will go to a mission hospital for the good medicine, and then the gospel or Christian principles can be portrayed as you're taking care of them, but they're not coming to you because you're a Christian. They're coming to you because you take good care of them.
Right.
And so that's kind of the model that Dr. Ledford set. Now he's in Kenya, still being a missionary, doing mission work over there. And we're trying to keep that model. So it's not necessarily in your face as far as crosses or anything like that. We do play WAFJ.
We like that.
There. But we would like that people are more coming to us because we're taking because we're Christians.
So we're talking tonight about staying healthy in a COVID-19 world. There's a lot to talk about. One thing I'm curious about is when we first heard the term coronavirus, there were a lot of people that were likening this to the flu. How is COVID-19 different from the average flu?
Yes. I mean, so you think about it, 6 months ago, you would have never probably thought of the term coronavirus.
Yeah.
I mean, nobody ever really thought of it being a problem. However, it's a common family of viruses that basically cause the common cold typically. And this is just a different strand of it that's a little bit more invasive and a little bit more aggressive. And almost, I think when you all asked me to do this, I was a little bit hesitant in some ways because I almost hate to speak another voice into this. And so I know as we're having this conversation, some people may get a little bit upset with some of the stuff I have, and because they have a very strong opinion.
Yeah.
And in today's society, I think as we've gone through this the last 6 months, there's been some polarized opinions on it.
Right.
And it's almost become a political statement. So I just preface that with saying, I'll provide as much good information as I can. And not everybody will agree with me. But when it comes to coronavirus 19, the symptoms are very similar to the flu. It can cause a runny nose, body aches, a fever, cough. And all those things just sound very much typical of the flu. But in this case, the COVID portion of it, where then you have the syndrome, is where this tends to be a little more aggressive in some people, ends up to drop a lot lower into the lungs and cause a lot of respiratory problems. So the more serious problems are the shortness of breath, and then potentially even along with that some chest pain and cardiac issues that can come on, not from the virus itself, but because some of the compromised things that can come if you have some underlying conditions. So it's the aggressive nature of this that's a little bit more different than just the flu.
Right.
And a lot of it has to do, too, with a little bit of the unknown that's been going on.
And is this more contagious than the flu?
Well, I really don't understand. That's one of the biggest problems, I think. Since it's come out, everybody has paid attention to the headlines. And in a 24-hour news cycle, social media kind of news cycle. There's just so much information that's kind of being thrown out as the latest and the greatest, but a lot of it is just still not known.
Yeah.
We would like to think in 2020 that science is that specific where we have just overwhelming knowledge. But if you think about it, in the last 6 months, we haven't had a chance to really study and understand this virus. So, they say that the average person could potentially still carry it for 14 days before they'll show symptoms. The average person somewhere between 5 and 11. But if you read on the internet or you read some of even the medical blogs, it'll be just changing as whoever's writing it in their opinion. So somewhere right now, we think somewhere we're up to 14 days, but really we don't really know.
Yeah. It's a very fluid situation, it seems.
And that's probably one of the hardest problems about this from the medical aspect is that it's so fluid.
Yeah.
Everybody wants to have the expert opinion and the headline. And so they're throwing out a bunch of information, and I think it's thrown society into huge panic over it, where it is something that we do need to worry and we need to respect, but we also don't need to live in paralyzed fear. And that's where I think a lot of people are living right now, is in paralyzed fear.
Do you feel like there are some people who are afraid to even come out of the house because they might get it?
Oh, definitely. I mean, there's people that are afraid to come in the office that have just set the statement as, I am not leaving my house. And people that have said that they haven't left for 3, 4, 5 months because they're fearful. And when you look at the statistics, so I pulled them before I came today, and you look at it, in the state of Georgia, we have a population of about 10.3 million. I guess that depends on what statistics you're going to pull, but about 10 million. The number of confirmed cases so far are 58,414 as of today. So it's a very small percentage when you look at the population, and the overall deaths have been 2,494. Now that statistic is going to change, and it is an unfortunate statistic, but the reality is that illness does occur, deaths do happen, and we just as a society have been very removed from something like this for so long, but it is not an overwhelming number. It's a huge number, yeah, but it's not overwhelming when you look at a population of 10.3 million.
So we hear in the news that the number of cases in Georgia and South Carolina are going up. Should I be worried about that?
I mean, I think you need to worry about it and respect it. But overall, what we have seen, at least from our offices and a small office standpoint, is almost all the patients that we have seen or we have heard of that have had it, only one of those, and from our standpoint that we know of, was actually hospitalized. And they weren't hospitalized more as a precautionary measure than it was a true need for hospitalization. Most of the patients that we have diagnosed have done very fine at home, very much flu-like symptoms. I'm not saying it was a pleasant experience.
Right.
It's still, they were sick, but they did fine once they got over the infection, which can last anywhere, somewhere between 7 and 10 days. Maybe 14 with some, a little bit longer. But not everybody that gets it is going to end up in the hospital and be part of that death certificate, that death statistic. And I think that's where people are so fearful that they think they're going to be that statistic. When you look at it, most of the deaths, when you look at the state of Georgia, unfortunately, are people with other comorbidities or other problems that have made them predisposed to it. Mm-hmm. And also an age of a population that is much older, which would tend to lead to more complications from any kind of illness. So I don't think that is something that you wouldn't expect from any illness.
Right.
The same risk group that has the same potential risk for a bad outcome is the ones that are still that bad outcome. And it doesn't mean that we shouldn't worry about it, but you shouldn't be paralyzed by it.
Sure.
And if you are in those age groups or in those comorbid conditions, then maybe you do need to be a little bit more precautious.
You're watching Let's Chat About That with 88.3 WAFJ. I'm John from the Morning Show. Dr. Chris Apostol from Evans Medical Group is with me. We're talking about staying healthy in a COVID-19 world. This is interactive, so if you have a question, feel free to ask that on whichever platform you're watching from this evening, whether it's Facebook or YouTube, and we'll get to your question just as soon as possible. So, Chris, if I think I might have COVID-19, what do I do?
Well, yeah, it's going to be dependent upon how bad you think you're feeling, right? So, if you're having a cold-like symptoms, do you necessarily need to rush out right then and try and find out? The end result, whether you have it or not, is not as important as how are you doing right now.
Yeah.
And so if you're sick And if you're sick with coronavirus 19 or you were sick with anything, well, you should not be going out in public. You should be staying away from others. You should be isolating yourself. But if you're really worried about it, there are places in town right now that are doing the virtual screenings. Augusta University does one of those virtual screenings where they can determine if you would meet the eligibility for testing. And then, Urgent MD is also doing those, and you've seen them in the newspaper. Some of the health departments have started doing it also. But I think one of the other things that you can do is reach out to your physician and ask them the question. You don't necessarily have to make the appointment, but a lot of us have tried to modify the way that we can interact with patients. We're using either telemedicine or the phone to see, hey, is this needing to be screened or brought in? Does it even need to be tested for coronavirus right away? The tests are very widely available. So nobody in our area should have any problem getting a test. You might not get the result today.
Yeah.
But you can get the test either by nasal swab or the antibody testing to see that you've already had it. So there's not a shortage around here. It's just you might not need the information. You might not get the information the day you want it.
What's the average return time on a test?
It really depends, I think, on the lab that's been used right now. We use all the commercial labs, and the most have been up to 3 days, but we get some back the next day. Yeah. And I think that must depend more on their batch, how much have they gotten in, the kind of priority of who the patient with the criteria, because we have to fill out a form on every one of these tests to kind of stratify them. And so I think that does play a role into it too.
And I get the impression that most doctors, if they have a patient who thinks they may have coronavirus, don't want them rushing out and coming to the office immediately. They prefer for them to call.
And that's true. Yeah. And that's what we've preferred. And we kind of had to try and fluidly make it through that system. Right?
Yeah.
Because unfortunately, there's not really been a consensus of guidance on how to do that. So you would think in our society and everything, you see stuff published by the CDC or the World Health Organization or even the Georgia Department of Health, Public Health, there's not really a guideline on how a primary care office should function. So we're trying to take the best information that we can and try and work with that. Even our local hospitals have not all kind of banded together and give one position statement, which I think from a community physician standpoint has been somewhat of a problem. But from our standpoint, if you were to call our office and say, these are the symptoms, or portal in, we use a lot of electronic communication through a patient portal and send in your symptoms, then we can kind of risk stratify. Is this something that we should do a telemedicine visit? Mm-hmm. Is this something that we do want to have you come in? And if you do come in, we don't want you walking through the front door. We want to provide you guidance on how to get someone to be able to see you, whether we use a side door where we have some isolated rooms where we see patients that have been sick, or even in some cases we've gone out to the car to have to take a visual and listen to you and stuff like that. It's not ideal, but we're trying to balance that, take care of the patient, but also protect the other patients.
Sure.
If you really think you're sick.
And it seems most doctors' offices are doing the thermal scan before you walk in the door. It's the temperature gun, I guess you could call it. They aim it at your head and take your temperature. For some of us, that's kind of a new thing. What exactly is happening when they do that?
Yeah, I think it's more become one of the newest things too, because it's not anything that you have to touch necessarily a patient, right? So unlike the thermometer where you put it in the mouth or in the one in the ear, the thermal scans have been used before in kids in particular because of the ease of taking a temperature. But even then, I mean, it seems a little bit silly as part of that CDC guideline that's been put out. But to be honest with you, this entire time, we've only had 2 patients when we've done thermal scanning that didn't already realize they had a temperature when they came in. And those were just low-grade temperatures. Mm-hmm. So I personally, and this is where I might get somebody upset, think a lot of that is just making people feel better than actually screening for something. Because a temperature is incredibly nonspecific. And right now, with our penetration in our community at such a low level, that scanning everybody for a fever does not necessarily mean coronavirus.
Right.
It could mean a lot of other things too. So I think it's more for making you feel better and to say that you're following some guideline than it is an actual science there.
I'm John from the Morning Show. This is Let's Chat About That. We're talking about staying healthy in the COVID-19 world. My guest is Chris Apostol from Evans Medical Group. It is interactive, so if you have a question, feel free to ask that from whichever platform you're watching from tonight, and we'll get to that as soon as we can. Here's a question from Beth through Facebook. It says, it seems with all the protests not respecting social distancing that the virus would continue to perpetuate. What are your thoughts on that?
Boy, that's a really loaded question there, right?
I think it's a question a lot of people have because, we've been told not to come together in large groups. Obviously, churches have been very concerned about that. So is this something that we should be concerned about when we see the headlines with large groups of people coming together? Is that a way that it can spread quickly?
And I think that even right now, again, there's still so little we really know. As much as the experts are saying, we still don't completely know. And if you notice that, the World Health Organization kind of came out with one statement last week of, oh, well, if you're an asymptomatic carrier, you're probably not the one spreading it, which was what we were told before was the concern was all the asymptomatic carriers. And now there's been this argument of what does it mean by asymptomatic carrier? How are you defining that?
Yeah.
So I think there's just it has become such a politically charged. You also notice in one of the articles that they're saying, well, actually 3 feet is sufficient, but 6 feet would be better. So who's out there measuring that?
And then I've heard longer than 6 foot. What is it, 18 or something like that?
And then I guess if you're really sneezing hard and coughing hard, maybe it should be a further distance.
Right.
I do think it's a concern in some ways of kind of the larger crowds, but still we don't fully understand its full spread. So I think that's all speculation. And now we have on top of a huge political charge to it. So I don't know if I can answer that fully as far as saying it probably isn't going to help.
Yeah, but we just don't know.
We just don't know.
Yeah.
I mean, we're really in the midst of an experiment to see who is right. And you notice that at the beginning of the pandemic, a lot of the estimates of what was going to happen, right?
Yeah.
Running the statistics and the models and see what's going to happen. Some of it never really panned out in some areas.
Right.
Some of it panned out pretty bad in other areas. And this is going to be another one where you're going to have to see. Yeah.
So along this theme of staying healthy in the COVID-19 world, I want to talk about one of my favorite subjects, hand sanitizer. Chris and I constantly have conversations about my germophobia. He likes to rib me about it. So I have noticed that hand sanitizer is starting to come back in stores. A lot of what I'm seeing, though, is the spray kind as opposed to the gel. Is there a preference when it comes to that? Are they both the same? Is one just as effective as the other? What are your thoughts on that?
I think you'd be far more effective if you would wash your hands.
Well, that's true.
Soap and water would be far more effective.
But if you don't have that.
And if you don't have access to it, even I would just prefer the washing of the hands with the soap and the water. The one thing I've seen, at least it was kind of funny when all this stuff came out, not funny, but when all this stuff started with coronavirus and everybody was using hand sanitizer and sanitizing everything, we started seeing a rash of rashes for the first kind of 2 weeks of people coming in. A lot of them were kids because the parents were using hand sanitizer, sanitizing everything, and then kids are going to take whatever they have, toy or whatever, and put it in their mouth.
Yeah.
And so we had a bunch of kids coming in with rashes, and I think it's more from the chemicals that are in some of these things. So I do think you have to be somewhat precautious. You have small children and you're planning on dousing them every time with hand sanitizer. Is it really wise to be doing that versus just taking them to the sink and having them wash their hands?
So your first choice is soap and water if it's available.
If available.
But if it's not available,
you have to do what you have to do. But
okay,
just be cautious.
That's fair. So let's talk about masks, because that's another buzzword during the whole coronavirus pandemic. Are they effective? Is there one that's more effective than the other? What do you say about that?
Yeah, so that's another politically charged.
You might make some people mad with this.
I'm going to make some people really mad with it. Even with that, I think you've seen the position statements change this entire time, right? When we first came out, it was no mask. And then all of a sudden it was mask. Why? Well, part of it was because we were more concerned about hospital workers and people that were going to be in high contact. So if everybody ran out and grabbed masks, then there would be none for purchase for the people that really needed them on those front lines. Now, of course, everybody's making them, or friends are making them, or whatever, and they're able to actually be accessed in the stores if you notice them. I think the concern with the mask. Well, I'm going to make people mad, probably.
Hey, it's a candid conversation.
Well, so, what I have seen with people that are wearing masks, they're not usually wearing them in the right place.
Yeah.
Right. So their nose is out. Well, that's not really helping overall. They're fiddling it with their hands, and they're constantly moving it and maneuvering it. And then whatever was on the inside is now on the outside. I've seen people grabbing them out of their purse, and they've been in there all wadded up, and then they're pulling it out. Well, is that really a wise idea to be storing it in a purse or a pocketbook, or hanging it from your rear view mirror, or maybe on the floorboard of your car? So how protective are those kind of things?
Yeah.
Right. And when you look at the studies, even the recent one that was in the Lancet that was kind of quoted, is saying that they could be effective. Now, the ones that were more effective, of course, the N95s.
That's the fancy one.
The fancy ones.
Yeah.
Those are the more weaved of the cotton ones that I think it's like 12 to 14 layer thick of cotton, or respirator versions. Well, if you've ever tried to wear an N95 and actually function and do stuff, it's rather difficult.
Yeah, I would imagine.
And for some people, it may be actually more dangerous for them to be wearing an N95, especially if they have compromised lungs already, or asthma or something like that. It might be very difficult for them to do. And then you start getting down to the cloth ones or whatever. How effective are they? We really don't know. And it's a guideline that the CDC has put out. It's not a law.
Yeah.
And nobody still has proof that they're actually going to be beneficial. So I think a lot of these stores are making guidelines, and as you can see, Costco has made it a rule that you can't go in. Whether that's beneficial or not, we really don't know yet.
You think a lot of it's just folks wanting to be safe rather than sorry?
I mean, I think that's part of it. We have to feel like we have to do something.
Yeah.
And that's probably where I would make people a little bit upset. In our office, we don't necessarily require people to wear a mask. Almost everybody's bringing them in, but we do ask them their comfort level. But when I'm sitting there engaging in a conversation with a patient, for what I've noticed, it's rather difficult to have a conversation with somebody when you're wearing a mask.
Yeah.
They don't understand you. I don't understand them when they're speaking. You're having to be repeating what's going on, especially for some of the senior adults who have a harder time hearing, or believe it or not, many of us use lip reading, even slightly, even if we have good hearing, to be able to see. So it's rather difficult to have that communication. And there's also some other nonverbal cues that you get when you're talking to somebody and you can actually see their face, especially in medicine, the grimacing, the scowl or whatever. I need to be able to understand how you're reacting and to be able to see it. So if it's a comfort level of the patient, we'll be glad to wear it, but we're not wearing it for absolutely everyone. Now, if they are sick or they have symptoms, yes, then we do. But anyway.
A lot of people I talk to say they wear it not necessarily to protect themselves from getting it, but to protect others from getting it, should they be a carrier.
Yeah, and that's the big question is, are the asymptomatic people actually able to spread it? Still unknown.
Yeah.
Still unknown. And, I think from an ultimate thing, and this is maybe not medical, but this is a little bit more on the personal side.
Yeah.
Society does have somewhat of a risk. And in our area, the penetration is incredibly low. And you could argue maybe it's low because we followed really great guidelines or whatever. I'll let you decide that one on your own. But at some point, we have to decide, is this how we're going to want to all live?
Yeah.
And we're going to have to take that risk,
How long do we keep doing it?
How long do you keep doing it? I'm 51. Do I want to live the next 40 years always wearing a mask?
I hope not.
And never be able to see? And when is the end the end?
Yeah.
And so, I think what we've seen is 1 to 2 cases. If you average it out in our Richmond and Columbia County, as we've kind of figured it out from when the statistics, our office was talking about that today. And so the penetration is there, yes, but it's not so overwhelming that I think we should be paralyzed by that fear. Now, if it makes you feel very comfortable to go out with it, I'm not shaming you for doing it.
Yeah.
And that is completely fine. But, whether you really need to, I think the jury's still out.
There's still uncertainty of the benefit of it.
Yeah.
You want to say anything to those people who have been wearing them in the car while they're driving?
Now that I don't understand.
I don't understand that either.
Yeah, I don't get that. Especially the people that are in the car by themselves.
Right.
So I'm kind of thinking you really don't need to wear it. The other one is they wear it in the car and they have the windows down. So
yeah. Hey, people are fickle. We all are. We all have our quirks. All right. This question is from April through Facebook. This is my co-host. Hey, April, from the morning show. Do you think COVID-19 cases will increase as we go into cold and flu season later this year? And do you think a vaccine will be ready by then? The $1 million question, Chris.
Yeah, and I'll give you the I don't know answer for both of those, but let's talk about it. So, when you talk about cold and flu season, we still don't know that either, right?
Yeah.
But the one thing I do know is when the cold and flu season hits, it's going to put chaos into people's minds, fear, because there's really not a great way to distinguish it between the two, right? Is it the flu or is it coronavirus 19? And then, are you at risk for the death? And I think you still have to go back to those statistics. You know, John, if you were to get it, you're young, relatively speaking,
Thank
right?
you. I need to hear that as I get more gray hair.
I know, younger than me. But if you get it, you know, statistical odds are you're going to do relatively well. And if you're taking good care of yourself beforehand, and you continue to take care of good while you're sick, then, you know, you don't have to rush into the hospital thinking that you're necessarily going to be the one on the ventilator. Could that potentially happen? Yes. And that's where probably people would get angry because they'd say, oh, well, I know this person that was, you know, 30 some years old and they died of it.
Right.
Well, there's probably a lot of other circumstances that you don't quite add to that one comment. But as a general rule, most likely you'll do completely fine with it, right? Same thing with the flu. If you got the flu, the majority of the time you'll do very fine if you take care of yourself and you watch out for worsening of symptoms. You don't need to rush to the hospital every time you develop the flu, right? You are going to feel bad. So I think the one thing that it's going to lay into it is just the chaos of fear, because everybody's not going to know which one is it.
Right.
Will there be a coronavirus vaccine? I highly doubt that. I mean,
really, even with all the companies that say they're working on one.
They can say they're working on it, but I think the one thing you have to question is how effective is it?
Yeah.
So you're not going to know efficacy or how effective it is until it's been out for a while, right? I mean, we have some vaccines in the United States, and we were sharing one. I was talking to you about one earlier. I mean, the yellow fever vaccine has been used in every other country in the world. Still not approved here in the U.S., has been used in trial status since 2016 at certain centers because the one that we were using is no longer available, and the FDA still has not approved that. That's 4 years of a known vaccine that's been used everywhere else in the world. 70 other countries use it, and it's not been approved by the FDA yet. So I would highly wonder if all of a sudden one was made in 1 year and it was put, or 8 months, I guess, by the flu season, was put on the market. How effective would it be? So
we will find out.
We will find out. I'll come back and if I'm wrong, I'm wrong. I'm sorry.
We'll do a follow-up.
Yeah.
This is Let's Chat About That. I'm John from the morning show at 88.3 WAFJ, joined by Dr. Chris Apostol from Evans Medical Group. And this is interactive. If you have questions, please feel free to ask them. And you can do that in the chat section of wherever you're watching from, whichever platform, whether that be Facebook or YouTube. And we've got a question from Diane. She wants to know, what is the cost for a coronavirus test?
Yeah, so what we have been told, so I mean, I can't tell you exactly what the cost is for it, but what we have been told that currently insurance companies are covering it, if not the government is covering it.
Yeah.
So that it should be free to a person that's interested to know if they've had it. Now you have to remember that there's different types of tests. One is looking for the actual viral particle. That's one thing.
That's the swab.
That's the swab up the nose.
You've had that done, right?
I actually did.
It was pleasant, wasn't it?
It was not pleasant. It was not a pleasant test. But so, you know, that one is going to tell you if you currently have viral particles.
Yeah.
Right. The other one is the antibody test, and that's a blood test. That's mostly going to tell you if you've made an immune response to the virus. So in that, there's different types of antibodies. There's some that show that it's a sooner infection or an early antibody that's made soon after you've been infected, and one that comes on later. And so those are available, but those don't necessarily mean you have the virus. That just means that you produce the antibodies, and you could have had the virus.
Yeah.
To be honest, we've had a lot of people requesting it, and we have been testing it. I think from the antibody standpoint, that's more demographic information, kind of figuring out how much did it penetrate, or I'm sorry, epidemiologic information. How much did it penetrate the community? And we have not really had anybody positive that didn't already know they had the coronavirus. So we've had people that had the coronavirus, that tested antibody positive. We have had people that tested positive with the nasal swab, and they were still negative with antibodies. So really, we don't even know what the antibodies mean. Does it mean that you can never get it again? We have no clue.
There are a lot of us who at the beginning of the year had this crud that was some sort of virus. And I know I had it, and it lingered as far as the respiratory effects of it. And then when we heard about coronavirus, a lot of us were thinking, well, maybe that's what it was. Maybe it was around sooner than what we anticipated. But I had the antibody test done, talking about Diane's question, and mine was negative. So
either you didn't make the immunity to the virus and you actually had the virus, or you never had the virus to begin with. And we still don't know.
And Diane, to answer your question, when I had the antibody test done, my insurance paid for it. So I guess you'd want to consult with your insurance if you do have that to get an answer. This is Let's Chat About That. I'm John from the morning show at 88.3 WAFJ. Love the questions. Keep them coming, whether you're watching on Facebook or YouTube. There are places there where you can ask questions. Dr. Chris Apostol from Evans Medical Group is our guest. And Beth has a question from Facebook. Should we be washing our vegetables prior to preparing them for consumption? And if so, with what?
Well, I don't think you necessarily be washing them for coronavirus. So the majority of the stuff you'd be washing them for is the other reasons you'd be washing your vegetables when you pick them up at the store, and just plain water.
Okay. Traditional water will do just fine.
And then especially when you're cooking them, right?
Yeah.
Cook off anything. So.
Right. Okay. Well, I want to talk about too some COVID-19 considerations for summer, because we all, I think, have cabin fever. We're all wanting to get out of the house. And with that, I think we have questions. Is it safe to go out of town? Should we leave town? What do you say to people who are trying to figure that out?
Yeah. So I think the hardest part about deciding if you're going to leave town has to be where are you going and what are the rules there. So unfortunately, we don't have a national standard of what the rules are.
Yeah.
If you go somewhere, right? I just had a person that was going to Alaska, and Alaska requires that you have a coronavirus test 3 days prior to your entry, or you have to stay in 14-day quarantine when you get there. So if you were just showing up in Alaska for your trip to Alaska, well, you might be in a little bit in trouble because, their rules are different there and they're not the same that are here in Georgia.
Yeah.
I recently traveled to Florida for a conference real quick, and we were stopped at the border and they were asking where were we from, because if you were from certain states, they were going to do something to you. I don't know what it was, if they were going to quarantine you or
not let you
caution you, or I don't know what it was, but I know I have never had to stop at a border between a state and the United States, and we had to stop at the border. So you have to know what the rules are for where you're going. And that's the hardest part because, I can't tell you every place in the country. The rules are going to be very different. So you have to do a little bit of investigation beforehand. And I think you have to find out the comfort level of who you're going to go visit, right? Some people that might be in a high risk condition might be more fearful of you coming.
Mm-hmm.
So is there any way that you can guarantee that you won't give it to them? No, there's no 100% way you can guarantee. If you took a test today and it was negative, doesn't mean you don't have it. Doesn't mean you just haven't. It just might mean that you haven't shown that you're positive, right?
Yeah.
And by the time you get there, you've traveled from one place to another. You could have picked up something. So what if their comfort level isn't for you? I think we have to respect their comfort level and just maybe postpone that.
Okay. And what about as far as swimming pools go this summer? Is it safe? Because I've heard it doesn't, the chlorine kills it. So.
And that's what the guideline just came out, right?
Yeah.
So they just announced that, there's no contact within water, but above water, the social distancing, you're supposed to remain at 6 feet. I think it's going to be hard, though, for some of these pools. How are you going to tell a child to stay 6 feet away?
Right.
You kind of laugh when I've heard parents are saying, well, they're having children's playtime, but they're social distancing. I don't know any 3 or 4 year old. They must be better than when my kids were 3 or 4, because my kids at 3 or 4 would never social distance. So they don't understand that concept. So
they're up in everybody's space.
Yeah. And the good news is still with kids, the risk of even if they get an infection is incredibly low.
Yeah.
The risk of complication or death is very, very low.
So let's talk about some of the everyday health things. I know from a physician standpoint, you've been concerned about this, perhaps with people being fearful of coming to a doctor's office because they're afraid they're going to get the coronavirus. They've been putting off the well care visits.
Mm.
If I'm being honest, I rescheduled mine a couple of times because I didn't want to be in the doctor's office when this was all first going on. What do you say to those people who maybe have been putting off those things that they probably shouldn't?
Yeah, I mean, I think it's a little bit scary when you see some of the things that people have put off out of the fear of what they could have gotten and then the conditions that they've already had. So just let's look at kids first. And this is, thinking about it, we've had parents that have postponed immunizations in kids because they're fearful that they might get coronavirus. Well, the risk of some of the infections that we're immunizing for are far greater than the coronavirus. And then also in some of those conditions, if they enter, I'm the last generation of physicians that probably actually saw the live chickenpox come in. And so I know what chickenpox looks like, but I've never seen live measles. I've never seen live mumps or rubella or diphtheria or some of these other diseases because we've had immunization. So I think the fear of parents postponing vaccinations for that fear is unrealistic. They should make sure that they protect their children for the things that we know that we can prevent. And when it comes down to it, in medicine, vaccines have saved more lives in this world than all the surgeries and antibiotics combined. And I know that'll get some people upset, but the statistics are true. Vaccines have saved. We have a lot of problems right now with, I think, diabetics. Mm-hmm. They've been postponing coming. They've been quarantined at home. They haven't been going out and exercising. And people are joking around about the COVID, the freshman 15. Right. And now we hear about the COVID-19 or the meaning 19 pounds or the quarantine or the quarantine 20. And so we've had some diabetics that just, I guess they forgot that their diabetes was still with them and they're just allowing it to go out of control. Well, that is going to be a very bad thing if they don't take care of that. Unfortunately, radiology centers had to shut down because of PPE and stuff like that. Women have gone delayed on mammograms. And so we'll have a backlog on that. Well women checks for screening for cervical cancer. We had colonoscopies have to stop for about 3 months because of the lack of PPE. That's a tongue twister. You have to say it too many times.
And you're the doctor.
I know. Well, it's a world of acronyms a lot of times. And then you have to start thinking, these initials, what does it actually mean? So, and so then people are continually delaying these things because, I won't have to worry about it. Well, some of these cancers, if caught early, are curable. Sure. Caught late are either deadly or much more complicated to treat. And so I think it was kind of funny when coronavirus started, the sick people were so scared to come in. So were the well people so sick to come in. We didn't have either, right? So the well people were probably the safest people. So we started calling the well people, and that's all we were seeing was well people and making sure that they had all their wellness visits or all their diabetic rechecks and everything, trying to keep them on schedule to keep them healthy. And for our office in particular, we're trying not to let anybody stay in the waiting room. So when you hit the door, you're back into a room and you're going to go out a different way. So I know a lot of offices are doing the same thing we're doing, is we're trying to streamline it, become much more efficient so we don't have you waiting to be seen. You're going to move through rather quickly so that we don't have any kind of need for social distancing in the lobby. Yeah. We're also not recommending a lot of family members or stuff coming. If your family member comes with you, they either have to come back or they have to go out to their car and wait for you. You can't wait in the lobby anymore. So anyway.
So it sounds like your message is don't be concerned about catching COVID at the doctor's office. If you need to go to the doctor, go to the doctor. It's safe.
It's safe. Yeah. And if you're worried, call ahead. Find out what their protocols are. I know for our office, we were having a special line that we gave to some people if we just needed to get them back. Especially we do some pediatrics. And if mothers had young children or newborns and they were really worried, we would have them call that number and then the nurse would meet them and bring them right back. And they never even walked in the front door. So I think a lot of other offices are trying to be innovative and trying to take that fear that people have and try and make you feel as comfortable as we can.
What about going to the dentist? Is that something people should be concerned about?
Yeah, I think you have to talk to a dentist about that. I mean, I do think it's very important. We've seen actually from our office standpoint, patients that have had delayed dental care because of abscesses and stuff like that, that we're having to temporarily treat as these dentists are now getting back up and running. And unfortunately, their restrictions were a lot different because, of course, with the oral fluids, they have a lot higher contact And with some of the stuff that they do, aerosolization of fluids in the mouth, outside in the air, are a lot more problematic. So they've had a lot more stringent restrictions on them. And so it's been harder for them to come out. But, I don't think you should delay it too much, especially if you have a problem.
This is Let's Chat About That. I'm John from the 88.3 WAFJ Morning Show, joined by Dr. Chris Apostol from Evans Medical Group. We're so glad that you're watching this evening. And if you have a question that you'd like to ask, we would love to be able to answer that. Feel free to ask away. You can do that on our Facebook page. You can also do that on our YouTube channel. And we have a question from Evan. This is my son, Evan.
Great.
and you'll understand the question once I read it. Do you think it's safe to go to arcades and high contact areas?
So I guess he's asking a question because he wants Dad to say yes.
He wants to go play video games.
I know, and I noticed on there his Alabama logo is on his Facebook. So
he did that for you because you're an Auburn fan.
I went to Auburn, so now my blood. No, Evan, you cannot ever go to an arcade again.
Thank you. That saves me some money.
Again, those arcades, we still don't know about how long does it live on hard surfaces and stuff like that. And they have to follow their own set of guidelines just from the public health standpoint. Whether you're worried about it or not, the rules are the rules that the government's laid out for reopening. And so, is there a risk? Probably. There's a risk in a lot of places too. So, Evan, I'm sorry. I don't think you'll be going this weekend though.
Let's talk about social media and COVID-19 because there's all sorts of stuff that you read. And I don't know about you, but I feel like that we're living in a day of information overload.
Yeah.
Especially with social media. There's some days where I just have to back away from it.
Yeah, and I think that's been one of our frustrations from a medical standpoint. And I know when all this stuff started, I was kind of manning my portal, making sure that when patients were emailing in after hours, trying to answer them and explain what their appointments was going to be, did they need to cancel or not. But I just remember right when this first started, one day I started getting questions from people asking me what their blood type was. And, I'm not a social media person. This is the first time I actually opened up Facebook after I had been retired for a very long time when you asked me to do this. And now I have a bunch of friend requests and I don't know what to do with them. But I was getting these emails about what their blood type was. And so I was thinking, this is weird. I don't usually get asked that question. And to be honest with you, if you want to know your blood type, donate blood. They will tell you. And if you're O negative, you will find out and be reminded every month that you're O negative because they'll want it. But that's not really an important thing for us to know from a medical standpoint. And by the time I got to number 6 or 7 on those questions, I was like, this must be something on the internet. So I went and looked, and sure enough, it was talking about coronavirus and blood typing and which blood type was least likely to have problems.
I remember seeing that.
And, I just finally had to create a position and cut and paste it so I could send back to all these people. But it all of a sudden ensued panic. And then all of a sudden the next day, I think all of our doctors' inboxes were filled with questions about what blood type was. When hydrochloroquine was thought to be potentially could prevent it, I had all these requests about hydrochloroquine. And to be honest, I have some rheumatologic patients that are on it, but I don't get asked about that very often. And so all of a sudden I had a bunch of email asking me for a prescription for this. And I was thinking, where is this coming from?
Yeah.
So I think the problem with social media is people read something and it could be posted, it could be not even true. And then they're inundating their physicians' offices with questions that are really inconsequential to what's currently going on in their life. It's panic. And it really becomes a hard thing for physicians to manage the true need versus just this emotional want that people have. And it's kind of what social media has created, this instantaneous social want. I want the information, even if it's wrong, I'll take it. And then it takes a lot of time for us to argue, well, that's really not relevant. And then the people get mad back at us that, well, what do you mean it's not relevant? I saw it on Facebook. Well,
it must be true if I saw it on
true,
Facebook.
But your blood type's not going to make a difference. And even if it had the one that was going to make you more likely to have a complication, was it going to change anything in that moment? You didn't even have the problem.
Yeah.
So I just find that social media is maybe a great platform in some ways, but it kind of fuels the hysteria.
Yeah.
And we don't need to be fueled in hysteria in today's day and age. We can't live in fear constantly about the what ifs. You know, God's ultimately in control, right?
That's right.
So we can't be living in fear.
Do you see with the availability of medical information on the internet period, do you have a lot of people that come to you thinking they've diagnosed themselves and they're telling you what's wrong with them?
And what treatments they should have and how frequently they should have it.
Yeah.
And yeah, I mean, and the hard part is trying to sift out good data from just random data. And, you know, it's funny, sometimes you get people that print off other people's blog lists because this is what they found. And they've never gone back and looked at, where did this person even get this information? You can believe some stranger that posted anything on a blog, whether than something that's really true. So I do find that rather difficult, and we have to try and weed through and try and explain. But there's still such an emotional charge to that some people get really frustrated and angry when you might disagree with what they're trying to pull up.
So your advice would be, let the doctor be the doctor.
Well, and I mean, I think it's wise to be informed.
Yeah.
I think it's wise to learn, but to become ingrained so much that you definitely know 100%, you know, if you put all your symptoms into a database, it's going to come up with a lot of problems. Now, help us guide you to the one that really might be the problem then. Don't come to us with a list of, I know I have this, and prove that it's not.
And I imagine a lot of times people think they have a worst case scenario because of what they've read on the internet. And it turns out it was nothing near that.
Well, I think we all do that, don't we?
Yeah.
I mean, that's what fear is.
Sure.
Fear is usually the expectation of the unrealistic, right? The majority of the stuff that most of us ever worry about actually never comes to fruition the way we worried about it. And even when something does result from it, it's usually minimal to what it ever was. And I think that's one of the hardest things, even as a younger person, even I had, was the worry of life and just always being fearful of that. But we can't be paralyzed by that fear and always taking into that worst case scenario. Our mind is our worst enemy in that. And I think that's where this whole thing with coronavirus happens. People are so fearful of what the disease says, and what are they going to end up with? Are they going to be one of the statistics that's going to cause death? But I just read to you, it's 10.3 million in the state of Georgia and only 58,000 cases in the whole state. Your odds are pretty good that you're not going to be that one. Now, you might be, but if you do get to be that point, then let's start dealing with that. And if you look at it, out of the 58,000, only 2,494 deaths. Now, go look at the statistics. The majority of them are over the age of 80, not saying that that's not bad. And please don't get me wrong.
Sure.
But if you're the 34-year-old that's paralyzed in your house out of fear, your odds are still pretty good if you got it.
Yeah.
Right? So don't live in so much fear that you're not able to live life at all.
Yeah.
You're just living in fear.
You'll miss out on everything that God has in store for you if you live that way.
And even if you're in the 80 and 90, you know, we had patients in our 80s and the 90s, and they were positive, and the only thing they had was a stuffy nose.
Mm.
So just because you're in your 80 and your 90s does not mean that that's a death sentence either. And granted, all these things do mean maybe you need to be a little bit more heightened. If you're in your 60s, 70s, and 80s and you were positive, maybe you need to have your family members pay a little bit more attention to you, you know, stay in the house, make sure that you're not having shortness of breath, make sure that you're still arousable. If you're becoming not arousable, not able to wake up, you know, that can be signs that they're not breathing very well or getting good circulation. So then they need to reach out for further help. But it's not a death sentence if you get it.
Right.
The statistical odds still say you'll do pretty well with it. And unfortunately, we don't have a treatment, right? There's not a pill that you can take that's going to automatically make it better. And even the cold medicines that we have are not going to make you feel awesome. I always kind of get frustrated when I see that Mucinex commercial of that green glob. And all of a sudden the person looks like death warmed over. And then all of a sudden they take one pill and they're running a marathon.
Right.
You're still going to feel sick. You're still going to have a cough. You're still going to have congestion. And God will heal you over time, just like the natural immune system will heal you. And it will take time. You're not going to be an overnight better. Not overnight better, but still, you know, take care of yourself and be precautious about what could potentially happen.
This is Let's Chat About That. I'm John from the morning show at 88.3 WAFJ. And I'm talking with Dr. Chris Apostol from Evans Medical Group about staying healthy in a COVID-19 world. We're coming down to the final minutes of our conversation. So if you do have a question that you would like to ask, feel free to go ahead and do that right now so that we can make sure we get that question in before the end of the broadcast. And this question comes from Kay on Facebook. After we wear a mask, should we sanitize them or just throw them away? Is it okay to wear a mask more than once? And what about washing them?
Yeah. So that's a hard one too, right? So, I have actually had patients coming in saying, oh, well, they douse them in hand sanitizer and then let them dry back out. And I'm thinking, well, would you really want to take all those chemicals, put them out, let it dry, and then slap it on your face? I don't think so.
Yeah.
So, we don't know how to wash them or anything like that. But I would say if it's a cloth one, go ahead and detergent wash it, like you would your regular clothes. If you want to hand wash it with, detergent in the sink and let it dry out and then reuse it, that's probably better. If they're the paper masks, you're not going to want to wash those. And I know for me, on some of the paper masks that we've had, that after half a day, the paper fibers on the inside start coming off and they start irritating me. And, then I want to start sneezing. And if I start sneezing in my office, then everybody thinks I have coronavirus, right? So don't want to do that. So I think those disposable masks are simply there to be disposed. So, wash them wisely. I want to put tons of chemicals on them that would then become an irritant to you. And then if it's a disposable one, they're meant to be disposed of.
And everything that I've read on the reusable one says don't put them in a plastic Ziploc bag.
Yeah, well, I think one of the hard parts is if you shove them in the plastic Ziploc bag, the front and the back are all together, right? So then you pull it back out, then your back becomes the front, or could it, contaminate? If you look at the CDC website, it talks about folding it and then storing it. So folding it with the inside in, right? And so the outside would be on the out. And then when you unfold it, you would be able to have the inside still just your saliva and you're not getting...
Man, that sounds tedious. What about, since we're talking about masks, what about gloves? What are your thoughts on gloves?
Wash your hands. Please don't wear gloves. The gloves are really not protecting you from anything. What you see with people that wear gloves is they don't wash their hands as much, right? We were recently in Savannah, and one of the requirements for one of the restaurants was that all the restaurant workers were to wear gloves. And I noticed, and I was watching, that the same people that were mopping the floor were also serving the food, were also touching their hair, because they were wearing their gloves, they didn't have the ability to go and wash their hands. And so all they're doing is spreading that whatever they've touched, whether it be coronavirus or just other stuff, all over the place.
Yeah.
If you are washing your hands, then you don't need to wear a glove. Wash your hands. If you want to, John, you can use the hand sanitizer instead.
Thank you.
Even from our standpoint in the office setting, and when nurses are drawing blood, a good portion of the reason the nurses wear a glove is not necessarily to protect you as the patient, it's to protect themselves if there's blood or something like that comes from drawing blood or whatever. So there is a bidirectional reason why we do that. But the majority of it is for the protection of the person that's drawing the blood, not to protect you from getting an infection, right? Because most of the time our gloves are just in a box.
Right.
They're not sterilized gloves anyway. So if you're out and about in Publix and you're walking around, or Kroger, I don't want to give preference to one grocery store or another, just go in barehanded. And when you get out, wash your hands. You'll be much more likely to wash your hands if you've touched something than if you're wearing a glove. Then you'd have to be just taking off the glove, still wash your hand. Then you have to wash your hands. Then you have to put on a new pair of gloves. They're kind of useless.
We had a question about vitamins. Does it help to take vitamin supplements like vitamin D to build up your immune system to ward off the virus?
So then you would see that one will be one of those things that's been in the headlines.
Yeah.
It's about vitamin D. So, do we know? No, we don't know 100%. Will it work? Is it good practice? Probably. Most of us don't spend enough time in the sunlight anyway for vitamin D. So most of us do need a vitamin D supplement anyway. It's usually a universal recommendation. Even those people that say they want to know their vitamin D levels, it's probably far better just to take a vitamin D at 1,000 international units a day rather than even bother checking for levels. So.
We're coming down to the final minutes of Let's Chat About That, our online interactive series where we're dealing with some topics that are of importance to you and your family. And this evening, we happen to be talking about staying healthy in a COVID-19 world. And in these last few minutes, if you do have a question, feel free to go ahead and ask that. We want to make sure we get as many questions in as possible. And we have another one here. This one is from our own Cleve Walker, and he wants to know, does hot, humid weather really impact the virus?
I'm going to sound like a broken record, don't I? So, we don't know.
Yeah.
I mean, that's all speculation. So we really, really don't know. And, some of the stuff has come out that says UV light and outdoors exposure is probably less likely to transmit it, which is, seems much more logical. But whether it's scientific, that's a whole nother question. So we won't know yet.
Is there anything scientifically to show viruses in general that heat and humidity has some sort of effect on
There's
them?
been some implications that people will say, it's harder to transmit things like the flu virus and everything. Whether coronavirus does the same thing,
we just don't know.
We don't know. So,
well, in your opinion, as a doctor, how do you see us getting out of this? How do we make it just all go away? Because that's what we all want.
I know we all want to wake up. Every day I wake up and I'm just wondering if the nightmare's actually over.
Yeah.
Right. Every day just seems like a bad dream. And you kind of wonder, I don't know if we're ever going to go back to what we thought was normal, but I sure hope that at some point we do. I think we've got to realize that life has a risk. And if you look at every generation's or centuries, let's say maybe not generations, has had something.
Yeah.
But even if you look at it a couple of generations ago, whether it was polio or whether it was the Spanish flu or whether it was times when diphtheria or whooping cough or all these other viruses that most of us have never seen, or some of us don't even know those words that I just mentioned. Other generations feared those because they went through a society and they took them out, literally. And usually it was the younger that was taken out by a lot of those diseases. And they got through it. They ended up getting through it. Either they figured a way of protecting themselves through vaccination, or it ran its course and it went through and it kind of subsided, and then maybe it'll come out again. I think at some point that's going to happen with this. Now, whether somebody gets big boy britches up and kind of says, hey, let's move on, that's, I think, the problem with politics and the reality of medicine. Right now, I personally believe we have so much infighting and just anger over a lot of stuff politically that we don't have any place that's taken the lead and said, let's move on. And if anybody has, then you have another side that's arguing, let's not move on.
Yeah.
And I don't know how we get past that except for God to change the heart of people. And when it comes down to it, I mean, I think that's what it's going to take. God's going to have to change the heart of people. And then as people, we're just going to have to realize we can't live in fear. God never meant us to live in isolation. You look back at the book of Genesis, right? And, God said it's not good for man to live alone. I think it wasn't just for us to have a mate, and that was with Eve, but it's because we're creatures that are made to have interactions. And I can't live in my house for the rest of my life with just my wife and my 2 kids. I love them dearly, but we need interactions with other people.
Yeah.
And at some point, we're going to have to realize that risk is worth it. It's worth it to move on. Now, we don't need to ignore the virus. We don't need to be arrogant about it. We don't need to be naive. But at some point, we're going to have to realize that benefit far outweighs that risk. And I don't know when that'll be, but I'm really looking forward to the day. And I think some of us have done that. Churches are starting to reopen up, and they're attempting to make people feel more comfortable. But boy, is it so glad to sit there and sing a hymn with other people and to see other faces and to have them smile back at you and even get that handshake that we're being told that we're never supposed to do again, or giving that hug to somebody. That feels a lot better than that Zoom call.
Yes, it does.
And so I'm hoping that at some point we're just going to be able to move on.
Yes, I think we all hope that. Well, it's been a great conversation this evening with Dr. Chris Apostol from Evans Medical Group as part of our Let's Chat About That series. Now, next Monday evening, make sure you join Cleve Walker as he'll be chatting with Mo Huggins, who is the Next Steps pastor at Stevens Creek Church in Augusta. They're going to be talking about how people of all backgrounds can develop community relationships, not in spite of their differences, but because of them, making a difference with our differences. That's the topic of the next Let's Chat About That. Thanks so much for joining us this evening, and Thanks for listening to 88.3 WAFJ.